92-year-old Satnam will be one of the first in the general public to get the vaccine, a relief to her son and grandchildren, all living under the same roof.
My mother's in her 90s, so obviously she's more vulnerable, and we're looking forward to getting her vaccinated.
The shots will be doled out based on age. More than 4 million people will be asked to register in advance. Each will get a card proving they've been vaccinated.
Where we'll utilize our arenas, our convention halls, our community centers to make sure that we can get everyone who wants a vaccination a vaccination.
Starting next month, everyone over 80 will be eligible. By April, mass vaccinations for those between 60 to 79 will begin. And finally, in July, those 18 to 59 can get in line for the shot. Many groups have been clamoring for early access. Teachers, for example, today expressed disappointment they won't be an immediate priority. But the government says certain groups or occupations might be given early access as new information emerges.
We'll continue to follow the science and the data around younger people, but right now the focus is on protecting those who are most at risk.
Vaccinations for vulnerable populations are also more clearly defined under today's plan, all with the goal of reducing fatalities.
My most optimistic self says that we'll see a drop in hospitalizations and deaths within a couple of months.
Despite being far down the priority list, today's plan makes sense to 25-year-old Milan Man.
My grandmother, the matriarch of family with 7 kids and a whole bunch of grandkids. So as long as she's protected, and if I'm lower down on the priority list, that's fine.
For all families in BC, the key will be vaccine supplies and whether there's enough to meet the government's timeline. Greg Rasmussen, CBC News, Langley, BC.